odd, yet surprisingly common things that you experience with a newborn. This baby can't see well, it can't hold its head up, it sleeps all the time. Throw in the umbilical cord smack dab in the middle of this child. How does this not hurt? And then you're looking at this little thing and you're like, sorry bud, you're gonna be rocking a crop top with some sweatpants. Wait, it came off while you were changing him? Do you call the doctor for this kind of thing? Why is my baby yellow? Jaundice. How do I fix that? Sunbathe. I could do that. I hate tummy time. Yeah, don't cry, don't cry. When are you supposed to do it? The baby's either sleeping, eating, pooping. His head not look round. A helmet. A tongue tie, a lip tie, circumcision cleaning. Sorry, bud, this is a lot of stuff going on for you. And me though, right? Is there something we could have done differently during the pregnancy to prevent any of these things?
Not really. Those things like, tongue ties, helmets, jaundice, all those things are actually things that happen naturally in like the baby development and during the process of birth that are really not related to anything you could have prevented.
The umbilical cord, what attention does that need?
The umbilical cord, as soon as it's caught, there's really nothing else for parents to do about it other than keeping it dry. When you give the baby a sponge bath, you want to avoid that area. If you have to wipe it because it has a little bit of blood, it's okay to use some alcohol to wipe it, but you don't have to be wiping it all day long. Key to it is just basically to not get it wet. So don't give the baby a bath, like submerging the baby in water, like a formal bath until the cord has fallen off, which is usually between 1 week and 3 weeks of age.
And don't pull it off, correct?
Don't pull it off. It doesn't hurt though. I mean, it won't hurt the baby. If you accidentally pull it off, sometimes it gets caught on the clothes or on the diaper, and some parents are very afraid of like pulling it. It will hurt the baby. It does not hurt the baby. It does not cause any pain. If it falls off a little earlier than usual, it might form something called a granuloma, which is like a wet appearance, and it will need to be cauterized, which is also not painful for the baby. It's just we apply silver nitrate to the umbilical cord to make it dry. So sometimes after the cord falls off, if it's premature, like by being pulled by accident or when it falls out naturally, you might see some blood, like kind of dry blood, or you might see the base of the cord a little wet. And sometimes you can even see some yellow or green secretion there. That's actually normal. And it usually takes about a week for blood to go away or for the wetness to go away, and you don't have to do anything about it. But as soon as the cord falls off, you can actually give the baby a formal bath, like in the little bathtub.
What about jaundice?
Jaundice is basically yellow tinge of the skin of the baby or yellow tinge of the eyes of the baby. About 60% of babies will have it. So it's physiologic, meaning it's natural. What happens is the baby's hemoglobin has very short life. And as soon as the baby is born, it starts breaking off. The hemoglobin releases that pigment that's called bilirubin. Normally, bilirubin is handled by the liver. And because it happens all at the same time, like all those red blood cells are breaking, the liver finds it overwhelming to handle it. So once it breaks, then the liver says, okay, hold on, there's too much for me to handle right now. And besides that, the baby's starting to eat in the first few days of life. The milk supply is not in yet, so the baby's eating just a little bit amount. So some babies can get a little dehydrated in the first few days of life, and that's why they lose weight when they're born. That contributes to jaundice as well, because if you're not well hydrated, then the bilirubin will accumulate a little bit more. So it goes up, like it rises, and by day 5 it peaks, and then after day 5 it starts coming down. The treatment for babies is to make sure that you're hydrating them by breastfeeding often. That will promote your breast milk to come in. In extreme cases where the bilirubin is too high, you might have to supplement your baby with either breast milk that you have pumped or formula to make sure that it doesn't rise too much. And you can sunbathe the baby. The sunlight actually helps the body get rid of bilirubin. The whole skin has to be exposed, naked down to a diaper, and you do it early in the morning and late in the afternoon. Usually after day 5, it just gets better. It goes away. Tongue-ties are anomalies of the mouth. It's a string, it's called frenulum, that attaches the tongue to the floor of the mouth. In some babies, it's abnormally tight or too thick, and then it won't let the tongue move in the normal way that it's supposed to be moved. Sometimes the tongue tie can interfere with breastfeeding. Some moms actually have a lot of pain when the baby has a tongue tie because the tongue is not moving in the way it's supposed to be moving. And other times the moms don't have any pain, but the baby's not really efficient at the breast because it can't make the efficient movement for the milk to actually come out. So they suck, they nurse, and they can't gain weight. Sometimes it interferes with breastfeeding and other times it doesn't. So it's very baby dependent. When it does, there are procedures to actually cut that little frenulum, and that releases the tongue tie, and then the tongue can move freely. Later on in life, it could interfere with speech. It didn't interfere with breastfeeding, but it's interfering with speech, then it has to be taken care of. But other times you can have a tongue tie and really not interfere. So lip ties are pretty much the same concept. So it's a little string that attaches the upper lip to the gum. Depending on where that tie forms, sometimes that little string is attached to the middle of the gum. Other times it's just right between the gum, like when the gum and the lip form, which won't cause any trouble. And so sometimes what happens is those lip ties will prevent the baby from latching on properly to the breast. Although I have to say that usually lip ties are very flexible, very lax. And so with practice and latching, most babies are able to latch on well to the breast without having to do any procedures. So the helmets are a form of treatment for a condition called plagiocephaly. Plagiocephaly is basically the formal or technical name for an abnormal shaped head. The skull of the baby is very pliable. It means like it's very moldable. And babies spend so much time on their backs because that's the safe way for babies to sleep. And they sleep about 20 hours a day. So they spend most of the time on their backs, and that makes the head become a little flat. And the abnormally shaped head does not interfere with brain growth or development at all. But what it does is, because it's misshaped, it can cause functional problems later on. It can cause cosmetic problems also. So a baby that has a misshaped head can have, an ear that's higher than the other, a forehead that's a little larger on one side than the other. Other times it's so flat on the back that none of the helmets for sports will fit, for example. So if you're going to be a professional player, like a professional football player, you won't be able to fit the helmet. If you're going to be an engineer, you won't be able to fit a hard hat. So it does have implications, like functional implications for later in life. The way it's corrected is very early, because the skull is very pliable. Go to a specialist to have measurements on your head to see how much asymmetry you have or how much flatness you have on your head, and see if that level of asymmetry will require correction with the helmet. The earlier you do it, the easier it is, because the skull is more pliable the younger the baby is. The most important thing for the parents to do is do a lot of tummy time. First month of life, you might not find too much time to do it because the baby's always asleep. And when the baby's not asleep, the baby's either eating or you're changing a diaper. So it's really hard to do it. But you can actually do it on your chest. So the first month of life, you can put your baby on your chest, and that can count as tummy time. When you're burping the baby, you can burp the baby on the baby's tummy. When the baby's awake, any opportunity you see that the baby's awake, looking around, you can put the baby on their tummies. And then after that, once the baby becomes more awake, then you can do tummy time as much as you can, and that will help prevent it. And also having the baby engaged and turn side to side. At 1 month, the baby should be able to look at you, to fix and track. And so then you can engage the baby by getting very close, looking at your baby, making sure your baby looks back, and then having the baby turn from side to side. And that will help also. If your pediatrician realizes the baby's having flatness on one side or the other, not turning appropriately, then the first step will be to have you do more tummy time and show you some exercises to do for the neck. And the other step will be to refer you to a specialist.
Any advice that you would give to new parents?
The best advice I can give to a new mom and new dad is to actually look at your baby. Look for cues that your baby's giving. Sometimes we read so much that we are waiting for those things that the book said. We want to do it as a recipe sometimes because it gives us comfort and safety, like you know what to do. Sometimes we forget to actually say, okay, but what does my baby want? What does my baby need? My name is Luisa Arnal. I'm a pediatrician. I'm originally from Venezuela. I moved here in 2000 and did my pediatrics residency training at Baylor College of Medicine, Texas Children's Hospital. I've been in practice for over 12 years. Practice called Nurture Pediatrics in Bel Air, Texas.